As a physical therapist at Beth Israel Deaconess Medical Center, one of my main concerns is helping people get moving after surgery. Your surgeon will have some very specific recommendations based on the procedure that you had done about what you should and shouldn't do right after surgery. But we have some recommendations that just about everybody can follow. Pain medication can be a great thing because it will help you move around after surgery without so much pain. But you should be aware that it can also cause lightheadedness or dizziness, especially when moving from a lying down to a sitting position. Move slowly and make sure that you don't feel lightheaded. Try pumping your ankles up and down. That'll help the blood circulation get back up to your head. Then when you move from a sitting to a standing up position, stand for a few moments at the edge of the bed. If you feel lightheaded, go ahead and sit back down again until it passes. And then again, when you stand back up, make sure you're not still feeling lightheaded before you start to take a few steps. Breathing is something you generally don't think too much about, but it's important right after surgery to take deep breaths and fully inflate the lungs. Most people who are in pain take small, shallow breaths, and this only partially inflates the lungs and creates a lot of muscle tension in the neck and shoulders. To avoid this, you should learn to use your diaphragm, which is your main breathing muscle. To do this, place one hand over your belly and one on your chest. When you breathe in, allow your belly to expand into your hand, but watch to make sure the belly moves more than the upper chest. Breathe in through your nose and out through your mouth, slowly, expanding your belly each time. After some practice, you'll be able to do this without thinking about it. Getting out of bed can be difficult after surgery, especially if you've had surgery to the abdomen or chest. Getting up like this requires a lot of work for the abdominal muscles. In fact, we call it a sit-up and use it to strengthen the abdominal muscles. Getting out of bed shouldn't be an exercise. So to make it easier, roll to your side and let your legs go over the edge of the bed first to provide a counterweight so you can push yourself up. After surgery, you should think about wearing loose-fitting clothing that will be easy to put on and take off and can accommodate the extra bulk of any dressings you have to wear. Consider wearing pants that are loose-fitting and have an elasticized waist. Just make sure the waistband is not too tight around the abdomen. A shirt that buttons or zips in the front is easier to get on than something you have to pull on over your head. It's a good idea if you can prepare your home in advance so that when you come home after surgery, your freezer and refrigerator are full of the foods that you're able to eat and that are also easy to prepare. Also consider rearranging the items in the kitchen so that things you use most often are at countertop level. If you have to reach for items up overhead and your surgeon has restricted your ability to reach, consider using an assistive device like this long-handled reacher. In other areas of the house, think about clearing obstacles like throw rugs, electrical cords, or furniture that might interfere with your walking. Also, at night, consider putting a nightlight in to light the way from bedroom to bathroom so that you don't fall.